Did you know there is a Danish pharma, Novo Nordisk? It beat Denmark's GDP with slimming jabs. Just when people thought it was easy money, US rival Eli Lilly struck back harder. Its stock price even passed Tesla, becoming the first trillion-dollar pharma. In this $100 billion weight loss war, who will be the ultimate winner? "2023, the year slimming jabs exploded. The hottest shots on the market like Ozempic and Wegovy, and later Mounjaro, swept across all social platforms. You might think it's just more hype, like other fleeting diet fads. But this time, it is different. Even top journal Science endorsed it. Science picks a breakthrough of the year. It's like the Oscars of science. And the 2023 winner? Not artificial intelligence, not space technology, but these slimming injections, academically known as GLP-1 drugs. It won this top scientific honor because the results are remarkable. Wegovy helps users in 68 weeks lose about 15% of their body weight. Lilly's Mounjaro is even wilder. Trials show that in 72 weeks, subjects lost up to 20.9% weight, previously only possible with surgery. But GLP-1s started as diabetes drugs. During clinical trials, doctors found that while stabilizing sugar, patients lost their appetites and dropped weight fast as a side effect. Sharp pharma firms realized quickly, this wasn't a side effect, it was a gold mine. So they developed higher-dose weight drugs, leading to various slimming jab versions like Wegovy and Mounjaro. Why is Mounjaro the most effective? Scientists found gut hormones and GIP boost fat-burning efficiency. Mounjaro combines both hormones. The results are like a cheat code. But using any slimming jab comes at a price to see results. In the US, what scares people off is the terrifyingly high cost. Trump announced big price cuts at the WH, but halfway through, a pharma rep fainted right next to him. Too much pressure or something else? Before this press conference, US GLP-1 prices were incredibly high. According to a US Senate report, one Wegovy pen costs nearly $1,350 a month in the US. That's over 30,000 NTD burned monthly. But in Germany, it's just $140. In the UK, it's as low as $92, a difference of over 10 times. Research reports exposed that the monthly manufacturing cost is actually less than $5. Yet pharma sells it for over $1,000. The profit margins are terrifying. No wonder US senators asked CEOs why they rip off the American people. To make matters worse, most US commercial insurance and Medicare don't cover these drugs, so only the rich can afford to get thin. Who set these prices so high, earning billions from weight loss? That's right, the two pharmas Trump called to the WH. One is Danish giant Novo Nordisk. Their Ozempic and Wegovy sold out globally. Market cap hit $650 billion, exceeding Denmark's annual GDP. The other is US giant Eli Lilly. Though they entered late, they developed the hot-selling Mounjaro. So Lilly's share soared to 57.9%. Novo Nordisk slipped to 41.7%. Yes, you read that right. Together, they hold 90% of the market. Other pharmas like Pfizer and Amgen are just giants staring at this $100 billion pie, picking up the crumbs. Monopoly means they set prices freely. Plus, in 2003, pharma lobbying passed a law banning gov negotiation on drug prices, causing prices to skyrocket. But this situation was broken by Trump's aggressive tactics. He played his ultimate card. If they didn't lower prices, 100% tariffs on all imported drugs. The pharma companies panicked. They had to volunteer to negotiate. Since it was voluntary, it didn't violate the negotiation ban. Once settled, Medicare covered weight drugs for the first time. Gov procurement price is just $245, not the original $1,000 price tag. What about the general public? If you're a Medicare beneficiary, it's only $50 a month. For those without insurance, Trump launched the Trump RX website. You can buy at a discount there, starting around $350 a month. Trump seems unreasonable, but his move declared a new era for weight loss drugs. First big thing, obesity is officially a chronic disease. It's not just about diet or looks anymore. It's a national public health challenge. Think the price cuts are over? Trump's strike was just the beginning. It was merely the appetizer. Don't forget Novo's core patent. It expires in China by 2026 and in India too. Without the patent umbrella, Asian generics will flood in, entering the market at lower prices. That is the real price tsunami, forcing pharmas to stop coasting. Future competition will be brutal. The norm is now one shot a week, but rivals like Amgen and Pfizer are making monthly long-acting versions. Of course, the most anticipated thing is oral pills, no more needles. Swallow a pill daily to get thin. On this track, Lilly and Novo are gearing up. Neither wants to lose this showdown. This pharma-led revolution affects everyone in this era who has body image anxiety. Think about it. If slimming jabs or future oral weight loss pills became cheap enough for everyone, photo editing apps might crash first. Gyms and diet meal services too. Industries profiting from anxiety. If that day really comes, will your diet sacrifices feel absurd? Whether you've used the jabs or not, share your wildest weight loss stories.